your lecturer from SNS College of Allied Health Science. In the previous session, we have started with the topic from osteology, that is fibula. So in this class, we will be continuing with fibula, as well as we are going to see the fibula's relatives, tibia. So basically, the fibula, I have already given about the introduction of fibula, where we state that fibula is a long slender bone in the lower leg, and then it is also located in the lateral portion aspect. So it also has a proximal end as well as a distal end, and then it lies within the lateral leg muscles, and which is related to the tibia. And then we have proximal end, distal end as well as shaft. On the proximal end, we have head, neck, facet on head, apex, etc. While the shaft in the distal end, shaft is usually a slender triangular with anterior, posterior and intraosseous border. As well as we have distal end with lateral melanus and mallear fossa. So also we have seen about the side determination of fibula, and then ossification center, especially primary ossification center. And then about the blood supply, where nutrient artery and the periosteal artery, distal end is supplied by both perioneal as well as posterior tibial arteries. And also about the anastomosis, where around the ankle joint for collateral flow. And then also we have seen about the applied anatomy, which includes the muscle attachments like proximal end, shaft, distal end and their functions. And also we have seen about the clinical relevance, fractures, myoneway fracture and nerve injury, as well as the ankle sprains. So about this I have to explain. So basically these fractures are usually common in the lateral malleus, that is ankle injury, as well as in the shaft is usually or commonly due to trauma. And then myoneway fracture is due to the proximal fibular fracture with ankle injury, as well as this nerve injury is usually common perioneal nerve injury at the fibular neck. As well as then we are just going to see about the ankle sprains, which is usually caused by the lateral malleus ligament damage. And then about summary and key points, I have already told that this fibula is a slender lateral bone of the lower leg. And then we have parts like head, neck, shaft and lateral malleus. Ossification is mainly primary center in the fetal period. By the fusion, it fuses by nearly 20 years of age. And then the blood supply is perioneal or tibial arteries. Clinical features like fractures, nerve injuries and ankle stability. We have already seen about these factors. For more information, kindly refer these books, especially Manipal Manual of Anatomy, Rosen Bilson and B.D. Chaurasia, Human Anatomy. Thank you. After this, we are just going to deal with tibia. So this tibia is the second largest bone in the human body, which is located medially in the lower leg, parallel to the fibula. It is usually a weight-bearing bone of the leg. It forms knee joint with femur and ankle joint with the talus. So the location of tibia is that it is a medial bone of the lower leg extending from the knee to ankle. And also we have proximal end and distal end along with the shaft. So these are the three main parts of the tibia, that is proximal end, distal end as well as shaft. So this proximal end articulates with the femur and forms knee joint, while this distal end forms medial malleus of the ankle. It lies superficially palpable along anterior shin. And then about the parts of tibia, we have already said that it has main three parts, which includes proximal end, distal end as well as the shaft. In the proximal end, we have medial as well as lateral condyles, which articulates with the femur condyles. And also we have tibial plateau, which is flat superior surface for the knee joint, and intercondylar eminence, which separates the condyles and ligament attachment. Tibial tuberosity, which is anterior, patellar and ligament attachment. In the next class, we will be continuing with the shaft as well as distal end. Thank you.